Welcome to Medical Minutes. I'm Dr. Amy Schreibman, and today we're going to talk about cholesterol. Cholesterol is made in the body by the liver and is carried through the bloodstream. It is also found in many of the foods that we eat. Much to people's surprise, cholesterol really is a good thing, and your body uses cholesterol to make hormones, vitamin D, and support our digestion. It plays a vital role in how our body works. However, too much of anything, like cholesterol in the blood, can increase your risk of heart and circulatory diseases. Cholesterol is carried through the bloodstream, and there are three main forms: LDL, which is the low-density lipoprotein, HDL, which is high-density lipoprotein, and triglycerides. All three make up cholesterol. LDL is called the bad cholesterol. Think of it as less desirable or even lousy cholesterol because it contributes to fatty buildup in the arteries known as plaque. Plaque builds up, narrows our arteries, and raises the risk for heart attack, stroke, and peripheral artery disease that can narrow arteries in our legs and other extremities. HDL cholesterol is the good cholesterol. Think of it as the healthy cholesterol, so higher levels are better. Experts have been shown to believe that HDL acts as a scavenger, carrying LDL cholesterol away from the arteries and back to the liver where it's broken down and passed through the body. HDL cholesterol acts to protect against heart attack and stroke. Although HDL cholesterol is good, it does not completely eliminate LDL cholesterol. Triglycerides are the most common type of fat in the body. They store excess energy from your diet. A high triglyceride level combined with a low HDL cholesterol or a high LDL cholesterol is linked with fatty buildup in your artery walls. This increases the risk of heart attack and stroke. The only way to find out if your cholesterol is high is through a blood test. When you get your cholesterol numbers checked, you will receive results for total blood cholesterol. This includes your HDL, LDL, and 20% of your total triglycerides. Triglycerides are the number that should be below 150 milligrams per deciliter. Triglycerides are a common type of fat, and if your triglycerides are high and your LDL is also high, or your HDL is low, you're at risk of developing plaque in your arteries, which makes them hard and not flexible. HDL, the higher this number is, the better. It should be at least higher than 55 for females and 45 for males. LDL, the lower this number is, the better it is. It should be no more than 130 milligrams per deciliter. If you don't have heart disease, blood vessel disease, or diabetes, it should be no more than 100 milligrams per deciliter if you have any of those conditions or a high total cholesterol. Those at risk for high cholesterol are people who are overweight, eat a diet that's high in fat and red meat, full-fat dairy products, saturated fats, trans fats, and processed foods, and have a large waist circumference, over 40 inches for men and over 35 inches for women, and do not partake in regular exercise. The American Heart Association recommends all adults aged 20 or older have their cholesterol checked every 4 to 6 years, and more often if you have risk factors, or if you're on medication for cholesterol, or if you have a family history of heart disease. Your test report will show your total cholesterol and your HDL, LDL, and triglycerides. HDL cholesterol are among the numerous factors that your doctor can use to predict your lifetime or at least 10-year risk for heart attack or stroke. To determine your cholesterol levels and how they affect your risk of heart disease, your doctor will also take into account the risk factors such as age, family history, smoking, and high blood pressure, along with diabetes. To treat high cholesterol, lifestyle changes are a must. You have to quit smoking, eat a diet rich in vegetables, grains, lean meats, and that are grilled or baked. And you have to include exercise. Sometimes even these changes, cholesterol-reducing medication may be required. High cholesterol can be concerning, but in most cases it's a warning signal. Being diagnosed with high cholesterol doesn't mean you'll develop heart disease or have a stroke, but you should take this information quite seriously. If you have high cholesterol and act to reduce it, your risk of heart disease and stroke will most likely decrease. Lifestyle changes reduce cholesterol and also support your overall health. Remember to follow us on Facebook, social media, and our website. And if you have any questions or feedback that you'd like answered, please leave your comments in the section below. I'm Dr. Amy Schreibman, and that's today's Medical Minutes.